So, nutrition assessment in critically ill, that is NUTRIC score. So, in this score, we have variables, criteria, and points. Variable, criteria, and points. And we'll first go with what is the first variable? The first variable is age. So, criteria for age is less than 50, 50 to less than 70, and more than equal to 75. Next we come to points. So what are the points for age? So if the person is less than 50, we'll give him a 0 point. In the second criteria, 50 to less than 70, 0.1. And the next criteria, that is more than equal to 75, will give him 2 points, him or her 2 points. So the next criteria is, after age, the next criteria is APACHE II score. What is the next criteria? It is the APACHE II score. APACHE II score. So what is the APACHE II score? It is acute physiology and chronic health evaluation 2. So now let's write down the criteria. So what is the criteria for APACHE II? So here we have less than 15, 15 to less than 20, 20 to less than 28, and more than equal to 28. So this is the APACHE II criteria, and will give us scoring always from 0. If it is less than 15, the score will be 0. If it is 15 to less than 20, the score will be 1. If it is 20 to less than 28, the score will be 2, and henceforth 3. So we have 4 criteria in APACHE II: less than 15, 15 to less than 20, 20 to less than 28, and more than equal to 28. And 3 criteria in age: less than 50, 50 to less than 70, more than equal to 75. Scoring is given. So let us see what is the next variable. Next variable is the number 3, SOFA score. What is the next variable? It is the SOFA score. And we'll come to the points. So what is the criteria? It is less than 6, 6 to 10, more than equal to 10. Let us give the points. 0 point for less than 6, 1 point for 6 to 10, and 2 points for more than equal to 10. So we have age, APACHE II, which is acute physiology and chronic health evaluation 2. And what is the full form of SOFA score? It is sequential organ failure assessment score. Sequential organ failure assessment score. So let us see the next variable. So the next variable is number 4, number of comorbidities. Number of comorbidities. So now we'll see the criteria. Criteria are 0 to 1 and more than equal to 2. Let us give them points. So 0 point for 0 to 1 and 1 point for more than equal to 2. So let's see the next one. Next variable is days from hospital admission to ICU shift. So the number of days of a patient who's been admitted to the hospital until the day of ICU shifting. So let us give the criteria. So the criteria is 0 to less than 1 and more than equal to 1, giving points 0 and 1. Points will be given in a similar fashion. So let us start totaling. So start totaling. So total will be either 0 to 4 or 5 to 9. 0 to 4 or 5 to 9. So 0 to 4 is low malnutrition risk. So 0 to 4 is low malnutrition risk, while 5 to 9 is high malnutrition risk. And this group of people with high malnutrition risk will need a nutritional plan. So let us revise as this completes our NUTRIC score. So what is NUTRIC score? So NUTRIC score is nutrition assessment in critically ill score. So there are multiple variables. Number 1 is age, number 2 is APACHE II, number 3 is SOFA score, number 4 is number of comorbidities, and number 5 is days from hospital admission to ICU shifting. So 5 variables: age, APACHE II, SOFA score, number of comorbidities, days from hospital admission to ICU shifting. Criteria is age less than 50, 52 less than 70, and more than equal to 75. Points will be 0, 1, 2. APACHE II 0, 1, 2, 3 points, less than 15, 15 to less than 20, 20 to less than 28, and more than equal to 28. SOFA score, sequential organ failure assessment score, less than 6, 6 to 10, more than equal to 10. Number of comorbidities 0 to 1 or more than equal to 2. Days from hospital admission to ICU shift 0 to less than 1, more than 1, more than equal to 1. So we'll total all the scores. If it is 0 to 4, then we have low malnutrition risk. If the score is 5 to 9, we have high malnutrition risk, and we need a nutritional plan. So this is all about nutrition assessment in critically ill, NUTRIC score, which helps us in pre-operative assessment of nutrition in surgical patients. And we'll learn more about nutritional assessment in the upcoming pre-operative sessions videos.